you're muted. Foster, you are muted.
Oh,
okay. Dr. Chris, can you guys just make sure that the I think it's a little bit complex the way you're joining now. The MECs, I just saw a message from MEC of Eastern Cape trying to join. I don't know if how you've shared this with the MECs and this thing needing a email address and so on, whether they're going to find it easy. What does it require from their side? First up, as before we start, just want to make sure my colleagues, we've invited them to join, but if it's going to be complex, I don't know whether any one of them is on the platform, whether they are struggling to get in.
okay.
Dr. Chris, maybe you can just
Minister,
check.
I see them in the attendees. I can see a lot of the MECs and HODs and our senior managers in the attendees.
Can somebody just assist the MEC for Eastern Cape?
Yeah, we are told our IT colleague is busy upgrading all the MECs and other key panelists. As we speak, she's busy identifying them from the attendees to be the panelists.
Okay, and the presenters, the scientists, I don't see them as panelists.
Let's quickly get them join quickly.
Yeah, I don't know why you did it this way, rather than just get them everybody in.
Yeah, Honorable Minister, we are busy trying to get them upgraded, all of them, so that we can quickly start.
Yeah, you don't even have your panelists, I mean your presenters.
The presenters, let me.
Dr. Lessels is waiting to be upgraded, and Tulia de Oliveira is struggling to get in.
Yeah, that's why I'm saying this looks more complicated.
Let's quickly assist. I'm trying to look for them on the list to upgrade, to upload them, to upgrade them. Looking on the list.
Apology to everybody on the platform. This is looks a little bit more complicated between attendees and panelists. And now the people who are going to make the presentation are not admitted as yet. So this doesn't help at all.
Minister, I've resent the link and I've been on the phone to Prof. de Oliveira, so hopefully he'll be able to link now.
Sure. This is not good.
Okay, Richard Lessels is in, Minister.
But where is Tulio?
He's just trying to join.
Yeah, this is a bit more complicated. Richard, maybe just to find out.
Tulio is just is here. It's going to be upgraded. We are trying to upgrade Tulio so that we can start with the briefing, Minister. And
okay.
Okay,
yeah,
Minister,
it's been upgraded now. Yeah, I think
Okay,
now
Foster.
the key members of the panel have joined. We can officially kick off the media briefing, Honorable Minister and fellow members of the panel. Today, we've invited sign language. As you can see, we've got the Kathleen Net who's going to assist us with the sign language interpretation. Good afternoon, ladies and gentlemen, members of the media, members of the panel, Honorable Minister, Honorable Deputy Minister, our fellow colleagues. Without wasting any time, we are going to officially kick off this media briefing. I'm going to hand over to the Honorable Minister, Dr. Joe Patla, to take us through the purpose of this briefing. Over to you, Minister.
Good afternoon. Thank you very much, Mr. Mohale. Afternoon to my colleagues, MECs from all the provinces who have joined, Deputy Minister Lomo, HODs, members of the media, ladies and gentlemen. We've called this media briefing to put some facts into a matter which of public interest. Many members of the public have been noticing that the number of reports of positive COVID-19 infections have been rising over the last, let me say, 7 to 10 days, started gradually, and over the last few days, over the last 4 to 5 days, there has been more of an exponential rise, starting about 8 days ago, where we had the total daily infections on the 16th of November, just having a total of 273 positive cases, rising steadily the next day to almost double, and then to the region of 700, 800. And as of yesterday, we passed the 1,000 mark at over 1,200 positive cases. Now, this, in terms of further analysis from the NICD and National Health Laboratory Services, breaking this down into geographic location, it was found that the bigger number of positive cases were in the Gauteng province. As of yesterday, at least 80%, started at about 64, 65, and then as of yesterday, as high as 80%, when we reached over 1,200. 80% of those were in Gauteng. Within Gauteng, over the last few days, the observation also from the source of the positive cases it was the bigger number was in the Tshwane Metro, but over the last few days also growing into other parts of Gauteng, Johannesburg, Ekurhuleni, still with Tshwane accounting for the bigger majority. So as a result of that, we've been communicating with our scientists as well that they should help us to monitor what's happening so that we can have more information as to what is driving this spike. Initially, it looked like it was just some cluster outbreaks, maybe gatherings and so on. Some of these were attributed also to some university campuses like TUT area in the Tshwane Metro. But from yesterday, indication came from our scientist colleagues from the network for genomic surveillance, that indeed they were observing what looked like a new variant. And we immediately then said they must confirm and then brief us this morning. So this morning we had a briefing by the team led by Prof. Tulio de Oliveira, who's also accompanied by Dr. Richard Lessels, who gave us a briefing, and we then said that we need to go public on this matter. So without any waste of time, I'm going to ask Prof. Tulio de Oliveira to take the platform and brief the public on what is their finding. Over to you, Professor.
Yeah, good afternoon, and thank you, Minister of Health, Joe Pashler, Deputy Ministers and MECs and members of the media for coming with such haste and urgency. Yeah, as the Minister of Health highlight, yeah, unfortunately, we have detected a new variant, which it is a reason for concern in South Africa. And so what we have done is to act very quick, and that's going to become evidence as a truly collaborative network of scientists in South Africa, together with the government, to try to identify that as the case that just start to increase, to really know what really we are facing. So the main message to take is that you have to know the enemy in order to fight. So both myself and Dr. Richard, we're going to do a short presentation, should take only around 15 minutes, but it's very important to highlight that is in no way that's only our work, but this is through the Network for Genomic Surveillance in South Africa, which is a really amazing network that have been set up very early, around February last year, when we saw the emergence of this virus in Wuhan, China, to really try to understand how that is transmitted and if there was evolution in real time. So as you're going to notice, it includes 7 big universities in South Africa, and each of the time you have a green box. That's a lab from the NHLS. Very important collaboration. Also very important in the network, the role of the NICD, which has been crucial also in the identification of this variant, not only with NHLS, but also working close with private laboratories. This program has been really funded mostly by our own government, the Department of Science Innovation and the South African Medical Research Council. Yeah. So I'm going to start with a summary, and we're going to finish with a summary, and we're going to give you some information in the way about that. Yeah. So just the summary is that we have detected a new variant. Yeah. And this variant at the moment got a number, or a lineage number, that's called the B.1.1529. Tomorrow, we are sitting with the World Health Organization Technical Working Group, and we do expect to get a Greek name for this variant as the other ones, because very important to understand that even that we detected here and very quick doesn't mean that this variant is from South Africa. Yeah, was just detected in South Africa, and we shouldn't use any country name for discrimination, but also to avoid other countries to come public that. This lineage, which will become a variant with a Greek name probably tomorrow, has very high number of mutations with a concern for predicted immune evasion and transmissibility. Yeah. So the B.1.1529, the current num, was produced in samples collected very recently from 12 to 20 of November from Gauteng in South Africa. We just complete close to 100 genomes, and by tomorrow it's going to be many more, but also have been detected the day before in Botswana and also in Hong Kong from travelers from South Africa. The one good news, if there is any news on this variant, is that this variant, the B.1.1529, can be detected by one particular PCR assay. So what it means that we can detect that very quick before whole genome, which normally takes days, and this will help us to track it and understand the spread. And what we can see is very early signs from diagnostic laboratories that this lineage has rapidly increased in Gauteng and may already be present in most provinces. That's what we will show you. We can make some predictions about the impact of the mutations, and we are making many here from our knowledge and all the scientific knowledge during this pandemic, but the full significance remain uncertain, and the vaccines remain the critical tool to protect us against severe disease. Yeah. So just to highlight, yeah, it is very new. 2 days ago was news about like first signs of fast increase of case in Gauteng. Yeah, not surprised normally how this virus normally emerge back. Yeah, it is to young people. That's the most sociable part of the population. And we are still asking questions 2 days ago. Is this a cluster outbreak? Is a real resurgence? Is the start of fourth wave? Yeah. And so in the last 2 days, what we really did as scientists in South Africa, which is around 36 hours from this media brief, yeah, it is to discover a new variant. And that was discovered from sample from the Lancet by scientists of the NICD that showed different results in the qPCR. As we, South African, then JSSA discovered the beta, working close with clinicians of the NetCare in the Nelson Mandela Bay. This one was discovered working close with other laboratories. Yeah, and these are very recent samples. Yeah, from 14 to 16 of November, which is the start of the rise of the infections in Johannesburg. In 1 hour, we call an urgent meeting of our consortium, the NGSSA, to discuss results, and we send a message for the Department of Health and the Department of Science and Innovation, which fund this program. Yeah, by 1 day later, we spent the whole day as scientists doing the detailed analysis of data. More genomes were produced from 8 to 100, and it's going to be close to 200-300 in the next few days. Yeah, and both at my lab at the CRISP, but also at the NICD, which really support this variant to be really concerned. We informed again our government, and yesterday, by the end of the afternoon, the first new reports came, and that's because it was a genome from Botswana and China, and that is already beginning to go to the media. So we found that's very important as we brief today our minister and our president, yeah, to talk direct to the media to try to give proper information. Tomorrow, we have requested and approved an urgent sitting of the World Health Organization Technical Working Group on Virus Evolution. Yeah. So just to highlight here where we are in South Africa. In South Africa, we are here. It's just seeing an uptick of infection after a deadly third wave of the Delta. But one of the key parameters is what we call the reproductive number. This reproductive number normally shows if these infections will increase or decrease. So for example, before the first wave was above 1, it decreased as the wave subsided. Before the second wave that was caused by beta again go up, and the third wave. And at the moment, nationally is at 1.47. And in Gauteng is approaching near 2, really highlighting that we expect, unfortunately, to see a very fast increase of cases. Yeah. It is very clear, very, very recent data from very detailed analysis about that show that in many areas of Gauteng, city of Johannesburg, we see in the last few days this fast increase of infections with a sustainable increase also seen first in Tshwane, in Ekurhuleni, in Cedarburg, in West End. Yeah, so it's quite clear that these infections coming up. What we didn't know is that cluster outbreaks, that's just clusters, introduction of the Delta variant circulating in Europe. And that's what we work to try to do that in the last 36 hours. Yeah. If we map in details, again, in Gauteng by the sub-district, we already can see very clear where it seems that these infections seem to be amplified. In no way I am saying that this variant emerged here or originated, but seem to be going to an amplification event. And what we are plotting here is during the last 3 weeks, what we call epidemiological week with the dates, the increase on positivity from testing. As we are aware, South Africa had a very low positivity of case, less than 1%, but start increasing here in Tswane and start moving east and west. And now it seems to have now increased quite high to up to close to 30% in a sub-district, really highlighting the emergence, amplification, but then spreading across the province. Yeah. And as we got the genomes, as I mentioned initially from Lancet with the NICD and now confirming close to 100 genomes, also here at CRISP, what we see is this very unusual constellation of mutations. Yeah, multiple mutation across the SARS-CoV-2 genome with more than 30 mutations. What it is the most important protein of the virus, the spike protein. Just to get an idea of the density of the mutations, if you get a look at the receptor binding motif, which is the area of the protein that will bind the ACE2 receptor, the beta had 3 mutations, the delta had 2. This new variant, the B1.1529, it has 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 mutations just at the receptor binding domain. Yeah. And in the spike, over 30 mutations, and between the virus, the whole genome, around 50 mutations. Many very, very different from other circulating variants of concern or variant of interest. Yeah. Some mutations are well characterized, not only by us, but all the scientific community, and with non-phenotypic impact, affecting transmissibility and immunity evasion. But many others have been rarely observed until now and are not well characterized. So the full significance is still uncertain. And that's what we are working at the moment. But we have spent in the last few days going through all our knowledge, the scientific literature and colleagues to try to understand more of the impact of these mutations. And now I'm going to ask for my colleague, Dr. Richard Lassos, to explain some of the mutations and also how this variant can be detected by normal qPCR tests. Richard, please.
Thank you, Tulio, and good afternoon, everyone. So as Tulio highlighted, when this variant was detected, we can see this large number of mutations across all the different proteins of this virus. And as he mentioned, some of these are familiar to us, but many of them are not familiar to us. And here we're just really listing some of the key mutations that we flagged and the effect that these are predicted to have on how this virus might behave. So you're familiar with some of the previous variants that we've discussed here in South Africa, particularly the beta variant. You're particularly aware of how some of the mutations in the spike protein affect how well the antibodies neutralize the virus. And here again, we see a lot of mutations in the spike protein that might affect how well the virus is neutralized. But we also see some mutations that are well known from other variants of concern and variants of interest. And they give us concern that these might give the virus enhanced transmissibility, so an enhanced ability to spread from person to person, and also to potentially get around other parts of the immune system, other arms of the immune system, and not just the neutralizing antibodies. And all these things are what gives us some concern that this variant might have not just enhance transmissibility, so spread more efficiently, but might also be able to get around parts of the immune system and the protection that we have in our immune system. Next slide, Tulio. Again, some of you are very familiar with these graphs that we show when we're looking at all the genome sequencing that's done in South Africa and how we see these variants change over time and how that then leads into the waves that we've experienced here in South Africa. So here you're seeing over time just the proportion of all the genome sequences that we generate and which variant they are in a different color. So there you see initially just this light gray, which meant that there were lots of different types of the virus circulating in the first wave. And then you see about this time last year, when we saw the takeover of the beta variant that drove that second wave of infections that was really devastating. And then you see with this red coming earlier this year is what we saw when the Delta variant came into the country and then took over and drove again that really devastating third wave. In the yellow, you can just see there at the bottom another variant that we flagged a few months ago that we were somewhat concerned about locally, and that's the C.1.2. And we've been tracking that carefully over the past few months, and we've still been detecting it, but at relatively low levels. And we didn't see that really take over and didn't see it translate into any resurgence in cases in any province. And now you see, as Tulio has highlighted, just this very, very recent data from the last couple of weeks of samples tied to this increase in cases in Gauteng. You're starting to see this new variant, the B.1.1.529. Next slide. And this is just another way that we show this progression over time with the different variants, and we show it according to each province. And this is just really to highlight, as I said, that at the moment we're detecting this in Gauteng province, because that's where we've focused the sampling and the sequencing, and the NICD have been working hard with the NHLS and with the private laboratories, particularly Lancet, to get samples from the recent cases in Gauteng. But what we're going to show you next is the concern that we have that this is not isolated to Gauteng province at the moment. Next slide. And that comes back to this point Tulio mentioned at the beginning, that one of the features of this variant, and it just so happens because of one of the mutations, one of the genetic mutations in the spike protein, we can flag it from one of the specific PCR tests that we use to diagnose this infection. And so you can get a sense before you do the whole genome sequencing of what proportion of the samples that are testing positive might be this variant. And so one thing the Lancet laboratories and the NHLS have noticed, again, very, very recently, just in the last week or two, is this very rapid rise in tests that are positive, but are showing this flag. They're showing this mutation in the spike protein. And if we go to the next slide, again, this is data because the NHLS collects such strong data and can analyze this data in real time. Here you show by the different provinces. And you see that although Gauteng is highlighted there, that there's this rapid rise in the proportion of the positive PCR tests that seem to be this variant, you can see a similar rise in many of the other provinces. And we have to caution here that that's based on a much smaller number of positive PCR tests, because the cases are not rising to the same extent in the provinces other than Gauteng. But it gives us concern that that this variant may already be circulating quite widely in the country. Next slide. So as you know from previous times, particularly when we detected the beta variant in South Africa, there's a lot we don't understand about this variant and what it means, and what it means particularly for how this virus might behave. And so what we've already started work on is trying to characterize the impact of these mutations on the behavior of the virus. And there, as with previous times, we're focused on a number of questions. We're focused on how transmissible is this variant? So how efficiently can it spread in the population? And there we're well set up, again, with all the surveillance systems from the NICD and from academic partner groups. We're well set up to understand that. And we're also helped by this fact that we can flag this variant on the PCR testing. And that will help us hopefully more rapidly to get a sense of the spread and the transmissibility of this variant. One of the key questions, as always, is around the vaccines and the protection that the vaccines offer and whether this variant affects that protection at all. As we said, we can make predictions, but we will only know for real by doing the studies in the laboratory. And you're again familiar, I think on the call is Professor Penny Moore, and her lab are the experts in setting up the systems to understand the effect on the neutralizing antibodies, and also Professor Alex Segal here in Durban at the Africa Health Research Institute. And that work is already ongoing just from Tuesday, from the detection of this variant. And then there are other questions around whether the protection that we have from past infection will protect us against this variant. And then really the key question comes around the disease severity and understanding whether we might see more severe disease with this variant or milder disease. And particularly that also ties to understanding in vaccinated individuals, if they're getting infected with this variant, what is the severity of the disease? And is that still predominantly milder disease? Next slide. So just to summarize before I hand back to Tullio, there's now lots of different strands of epidemiological data that are suggesting a sustained increase in COVID cases across Gauteng. And whilst that may have been kind of fueled by cluster outbreaks in educational institutions and elsewhere, it seems that there's now more generalized community transmission again. And we've detected this new variant that, as Tullio has mentioned, has got this complicated numerical name, but probably by tomorrow we'll have one of the Greek variant names to help us to use the terminology. And the public and private testing labs in Gauteng and increasingly in the other provinces are noticing a rapid increase in the detection of this variant on the PCR assays. And as we say, the mutation profile gives us concerns, but we now need to do the work to really understand the significance of this variant and what it means for the response to this pandemic. And as Tullio highlighted at the beginning, we can make some predictions about the impact of the mutations, but the full significance is uncertain. And just highlighting again this point that the vaccines remain the critical tool for protecting us from severe disease and protecting our health system from another surge in cases. So I'll hand back in case Tullio wants to make any closing remarks.
Yeah, thank you, Richard. Yeah, as highlighted, I think my closing remarks is that this variant did surprise us. Yeah, has a big jump on evolution. Yeah, many more mutations than we expected, especially after a very severe third wave of Delta. Many of the mutations are of concern, as we highlighted, for immune evasion and transmissibility. We can see that variant potentially spreading very fast, as the Minister of Health highlight the number of cases really coming very fast. And we do expect, unfortunately, to start seeing pressure in the healthcare system in the next few days and weeks. And the only thing, if it's any good about detection of variants, that we detect that very, very early as the resurgence happen. And we hope that we use that time very wise to prepare the health system. But especially for the public, we should really, really try to avoid super spreading events, cluster outbreaks. We understand that many people is finishing school, high school, university, and they want to go to holiday season, but that is the real time to try to stop cluster outbreaks so we can get in control of this variant and prepare the health system in case this variant that concern us and begin to concern the world, it is as serious as one expect. Of course, our best hope is that is not, and we really would like to be wrong on some of the predictions, but we thought that's very important to bring that to the public. Lastly, this is the work of a truly big network across many universities, many laboratories in South Africa, and this is the power of showing how hundreds of scientists can work together across the whole country to try to understand that in real time and feedback for public health interventions, and also to try to decrease this terrible pandemic. Thank you very much, and I would like to hold back to our Minister of Health to continue the proceeding. Thank you, Dr. Passler.
Thank you very much to our two specialists, Prof. Tulio de Oliveira and also Dr. Richard Lessels for very informative presentation, ladies and gentlemen. So clearly, it was important for us for this to be made public as soon as possible. Just to, amongst others, just to make us aware that while we had hoped for a very long, recess in terms of low infections, so that, a lot more opening up, a lot more activities, this has just descended on us. And as we have always said, we have no control. We had always hoped that any spike of infection leading to a fourth wave would be in the middle of December at the earliest, or late in December, or even in the coming year in January. But here is now a mutation, a variant of serious concern, which is now driving this spike in numbers. We were very optimistic initially that even as we saw the rise in numbers limited to Gauteng and also largely Tshwane and even some sub-districts, we're hoping that this could be contained, because we thought it's just a cluster of the Delta, but now there's a new variant which is clearly been identified. So it just again reinforces the fact that this invisible enemy we're dealing with is very unpredictable. So the tried and tested methods of prevention, non-pharmaceutical prevention of avoiding crowds, most of the time, if we have many people being outdoors, making sure that the social distancing, wearing of masks, the washing of hands and sanitizing, that we must keep those. Also, of course, at this stage, as the team has indicated, while there are areas which they are concerned about this mutation, the fact of the matter is that we also have the additional tool, which is the vaccination, which will help us to avert serious illness, including many of us ending up in hospitals, and not just in hospital, but in ICU, and even succumbing to this virus. So those are the tried and tested methods, which as we see this spike of infections possibly introducing the fourth wave, as they've indicated, as of yesterday's numbers, over 1,200, 80% of that is still in Gauteng, but we know the pattern, especially when the spike happens in Gauteng. Everybody travels in and out of Gauteng from all corners of South Africa. So it's given that in the next few days, the beginning of rising of positivity rate and numbers is going to be, happening. It's a matter of days and weeks before we see that. So it does present a major challenge in terms of further activities, social activities. We're hoping, amongst others, that we can have more social activities, but this is going to present a major challenge. Still have to be looked at. There will be meetings of government, of the Coronavirus Council and Cabinet over the weekend to look at the implications of this. On the economic side, what are the implications already in terms of traveling? As the team will be sharing this with the World Health Organization, as all countries are required when you pick up something to report, so that it can be monitored. Already, as you have heard, this has been picked up in Botswana, in our neighbor, but also in Hong Kong, in China. So what are the implications? Those are the things which, as government, you're going to have to be looking at. But over to you, Foster. I'm sure there will be lots and lots of questions. I know we don't have a lot of time because this was really unplanned. There are other activities later today. So, but I'm sure we should give at least, at the minimum, at least a half an hour to members of the media to raise questions for our specialists who are presenting. Thank you very much.
Thank you, Honorable Minister, and thanks to our two presenters, Professor Tulio and Richard. I'm going to take, as the Minister has already said, I'm going to take only to the maximum of 2 batch of questions in order to make sure that by 12:30, 2:30, we are done, but we'll continue to take more questions through the interviews, one-on-one and the like. So I'm going to read out the first batch of questions. First question is coming from Christian Duplessis from Network News 24. Although Prof has managed to respond to this question, but for the purpose of those who are not part of this, who are following through other mediums of communication or channels, I'm going to request Prof to respond to this question so that everybody get the benefit from this response. The question is, for clarity purpose, is the increase in cases in Gauteng being driven by this variant? I know you have responded, but for the benefit of others, please just respond again. The second question is from Rian Rothwell from Business Tech. This question is directed to the Minister and the officials. Is government planning to hold any meetings about possible restrictions to curb the spread of this variant? The third question is coming from Wangi from Cape Agus to Minister and the panelist. Is the Ministry able to confirm reports that as vaccine hesitancy slows the inoculation campaign? Is the Minister able to confirm if the vaccine hesitancy slowing the inoculation campaign? South Africa has asked J&J and Pfizer to delay the delivery of COVID-19 vaccines because it has too much stock. If so, will this order now be reversed, since the statistics are saying vaccinations remain critical for protection in the face of the new variant? Dr. Chris will also assist on this one. The other question is from CNN. Can you confirm the number of cases identified so far in South Africa, Botswana, Hong Kong, and tell us what about the 36-year-old man in Hong Kong who reportedly tested negative before leaving South Africa on his return? Few questions from Tamakan from Business Day. When do we expect to have the results from laboratory to work on the variant's ability to evade neutralizing antibodies generated by vaccine or prior infection? Another question from the same journalist: what do you know at this stage about how it evolved? What do you know about at this stage how it evolved? Do you think it will likely arose in someone with a compromised immune system, such as someone living with HIV or somebody who's been infected with COVID over a period of time? Another question is a clarity-seeking question from Record newspaper. Can the panel clarify whether this variant has been found in Tshwane, whether this variant is driving force behind the rising cases in the region and is leading in Tshwane? Even though it has been partly responded, but for the benefit of everybody, let's respond to it once more. Heidi from ENCA, how urgent is it for government or SAPRA to have the third booster shot of Pfizer, especially for the older age group who have received the jab around May? The last few questions from the SABC, Matlaku Komana: is the healthcare system ready to deal with the influx of spike in new cases? Second question from the same journalist: will the department be recommending a shutdown during the festive season? Don't know what does it mean, but the colleagues will be able to respond. The last question: are we able to determine if those who have been hospitalized have the new variant, if they've been vaccinated or not? I'm going to hand over to Minister and members of the panel to discuss and share these questions. Over to you, Minister and the members of the panel.
Foster, judging by the numbers, I'm not sure even whether we'll be able to take a second round, because as I said, this was not really planned. So we don't have a lot of time. There are other commitments for the day which can't wait. So let's do our best. I'm sure colleagues noted some of these questions. I'll just deal with the ones which I thought might be relevant to myself. Question of whether there are restrictions planned. As I've mentioned, this is very fresh news. We got a warning yesterday. I asked that we meet at 8 o'clock this morning. We got the report, and then we've been doing further consultations during the course of the day. We just finished the meeting with the MECs of health and the HODs. So there's been no time to even really reflect on possible decisions. So, but because we didn't want this to linger as rumor, we wanted it to be actually confirmed in terms of what's happening. So we're still going to have further discussions at various fora, including Coronavirus Council, including with the cabinet, including consultation with premiers, as the president would do that at some stage. So it's too early to really predict what's going to be the line of action. And as also, while the team of scientists will be studying and giving us further information over the weekend, will be more empowered. But of course, we are saying that from the experience of the last 21 months or so, we almost can predict how this is going to move, as I've said, especially when, like the Delta starting in Gauteng, you can be rest assured as people start to move even more over the next few weeks, this will be all over. So we're going to have to reflect within that context and further information. The scientific team will deal with some of the issues, neutralizing antibodies. The issue of booster shots, let me just deal with that. As we've always emphasized, we work also on empirical evidence wherever it's available, through also guidance by the World Health Organization. And whenever certain trials have been done, information submitted to SAPRA to look at safety and efficacy of certain interventions. So that's why we move step by step. So we're not averse to overall at some stage reaching a level where there can be more rollout of boosters, whether third shot of Pfizer or second shot of J&J as a general provision. But I want to emphasize again to say those are matters which are open for consideration Our ministerial advisory committees are meeting later today. They will give us some further advices on this. We'll look at those advices, compare with other information, and make decisions. But what I want to emphasize, our real sort of concern, overall, overriding concern, is we know that if more and more people are vaccinated, we can limit even the number of mutations. And also, when people who have some form of immune risk, including HIV and AIDS, the best protection is to make sure that you are on your treatment, which will make sure that you have a very good immune system, a high CD4 count. Those are the areas, if you're on chemotherapy and so on, protect your immunity. But overall, general South Africans, we are only at 41% where we are now. And the numbers have been reducing. We are far below 200,000 per day now. We're struggling even to get 150,000 in a day, hovering around 130 and 120 something, 130,000 in a day. Very less uptake by the 18 to 35 cohorts. We're still sitting at about 26% of population coverage. The 35 to 49, we're sitting at about 45%, which is not too bad. The over 50 approaching 60%, the over 60 just under 65%. So the older age group will want even more coverage, but we are worried, as it's been indicated, this outbreak is largely in young people. And the young people are only at between 25 to 26% vaccinated. So this is a very high risk at this stage. So that's really our main worry, and we would want again to take this opportunity to encourage more and more of our people to come forward to take the vaccine. So we can worry about boosters, it's fine, we'll get the science, but we do have the capacity, as we've always said. Whether, in fact, Dr. Crisp will speak about whether we've got too much vaccine stock to the extent of, I know that at some stage we did ask Pfizer to delay some of the deliveries to outer weeks and months so that we can reduce the stock at our disposal. But so that's a matter of discussion. The people who are managing the stock, I mean, like any other, somebody who managing a stock level, you need to look at what you have and not delay some deliveries if you are able to. But at the end, we would really not get rid of any of those which we have ordered. We want to make sure that as more people come forward, nobody should be denied the opportunity for a vaccine. In terms of readiness, that's what we're discussing with my colleagues, the MECs and HODs, to work on some of details to accelerate the resurgence plans, keeping our facilities ready to take this challenge much earlier than we thought. So those are the things which, that's why we had, and thanks to the MECs, because we sent a message, calling a meeting within 2 hours, and we had 100% attendance together with the HODs. So it's very encouraging. Whether there's going to be shutdown in Christmas, as I've said, these are matters which we're going to discuss. What kind of measures? We have learned a lot from the previous 3 waves, so we'll reflect on that and also learn from other countries. So with that, Foster, I think there are some areas where Prof. Tulio and Richard could take up some of those, and the acting HOD might take up some of those. Let me get back to you, and you can invite our scientists to take some of the questions.
Thanks, Honorable Minister, for that clarity. I'm going to allow the two, Dr. Richard and Prof. Tulio to respond to some of the questions. Then Dr. Chris will also come in once they're done. Over to you, Prof.
Yeah, thank you. So one of the question was about the clarity that this variant is in Gauteng. Yeah. And to answer that, I would like to invite Professor Anne, because she was the one that flagged for us 2 days ago, and she can highlight how widespread she believes that's in Gauteng. And please.
Thanks, Tulio, and thank you to all that are attending. So approximately 100 specimens have been sequenced and been confirmed as the new variant, and most of those are coming from areas within Tshwane and Gauteng. And I think if you remember very carefully, the map that Richard Lessels showed, that shows you the districts that are showing the highest test positives, and we think that reflects the distribution. So it was a bit narrower 2 weeks ago. It was mostly in the area related to the outbreak, and now the cases and the percentage test positive is moving into other districts and sub-districts within Gauteng. And if we think of the S-gene dropout data, we know that there are already data that there is an increase in the S-gene dropout in other provinces. So it might have been localized to start off with, but it's definitely spreading to other districts in Gauteng and Tshwane and also elsewhere in the country. Over.
Thank you, Professor Anne von Gontberg, from the NICD. So as Professor Anne highlighted, we have around 100 whole genomes that have been confirmed for us from one of the tests, that the qPCR. But as we look to the qPCR data in Gauteng, it's around 90% of the cases seem to have the decrease of that marker, which suggests that is the variant circulating there. And we are generating data from other provinces on the qPCR marker already showing other provinces, and we're going to be releasing many more genomes in the next few days. The network is really working around about that. So if it's okay, I would also like to invite Professor Penny Moore to answer the question about how long will and the process that take to answer the question about the neutralization of this variant onto the lab. Penny, please.
Thanks, Tulio. Yeah, this was a question from Tamara. We have already begun this work. It is complicated by the number of mutations that this variant has. That makes our lives as scientists somewhat more difficult to try to get there as quickly as possible. But we have already begun. I think it's important to understand that many of the mutations that this new variant contains are mutations, as Richard pointed out, that we know well. So from what we know about many other variants that have been described over the last 21 months, we know that several of the mutations in this new variant are likely associated with immune escape and with increased transmissibility. To get the actual data from the laboratory experiments will probably take a number of weeks. I also think it's important for you all to understand that when we talk about measurements of neutralizing antibodies, that is just one arm of the immune system. That data we'll have, as I say, within weeks. But the data regarding other arms of the immune systems, for example, T cells, which we know are really, really important for protection from severe disease, that work is also ongoing. To be able to pull all of that data together and to get a coherent understanding of the impact of all of these mutations will take us some time, unfortunately. But I think the important thing to understand is that we know many of these mutations. This variant contains many mutations that we're not familiar with, but based on what we know of the existing mutations, we know that we need to employ the non-pharmaceutical interventions. We know that we need to protect ourselves from infection while we wait for the laboratory data. Thanks, Julia.
Yeah, thank you. It's okay. I would just ask Richard just to comment which metrics we should be looking in the next few days, not only on cases, but what's the importance to also have good parameters on hospitalizations and clinical severity. Which data we should be looking to understand how severe is this variant for South Africa.
Sure, and Anne may also want to comment here, but I mean, I think the key thing that you notice is that always it's putting all the data together and trying to collate the data and understand what's happening. And so it's the different strands of the data, and they each tell you something slightly different, but when you look at it all together, then you get a clearer picture of what's going on. I think the key thing that we're looking to see in the next few days and a couple of weeks is around the severity of the cases. And often at the beginning of a resurgence, we sometimes get fooled into thinking that everything is milder disease, and that can be because it's initially spreading, as Tulio highlighted, in the younger age groups. So we have to see, as the spread becomes more generalized, whether we're seeing cases of severe disease, and we have to tie that together with the PCR testing data and the genomic data, and also the vaccination data, so that we can understand whether cases that reach the hospital, the more severe cases, how many of those are unvaccinated and how many are partially or fully vaccinated. So really it's about pulling all those different strands of data together on a rolling basis. And we're very lucky here that the NICD, working together often with the academic groups that are supporting the response, have those data systems and surveillance systems in place to give us a good sense, and working together closely with the diagnostic labs, the NHLS and the private labs. So I don't know if Anne wants to say anything more to that, but that would be my summary.
Yes, thanks, Richard. And I think I agree with you that I think the systems are in place, and hopefully we will have data available in the next few weeks to guide us and to tell us what is happening in the country. Over.
Okay, I would just answer the last question that I think that's for our group and pass back to the minister. Yeah, is relationship, how variants emerge and the role of immune compromised people on emergence of variants. Yeah, that's something that the scientific community know quite well since the emergence of the first variant, for example, the Alpha in the UK, is that certain times immune suppressed individuals, for example, people that just did transplant or longer-term cancer patients or HIV immune suppressed individuals. Very important here, the caveat, HIV is not the problem. People that are well suppressed on therapy will respond very well to infection of SARS-CoV-2, and that's the importance of HIV diagnosis and therapy. So what we know, the scientific community, is the role of immune suppressed individuals on driving the evolution of the virus, because they cannot clear the virus, what's called persistence infection. Yeah, that was seen in dozens of countries around the world and could be a potential role, but that's difficult, if not impossible, to pinpoint. One thing that we know about variants is that they don't only need to emerge, they also need to be amplified by super spreading events, and that normally, so everyone that gets infected with the same virus start transmitting and have the numbers to transmit to the population. Yeah, and that it is at the moment what we should be focusing on, not really on the origin of the variants. We will never know if the origin originates in South Africa, a neighboring country, or someone that arrived by plane in South Africa or by boat. That's impossible to know. But what we know that is unfortunately is causing the resurgence of case on Gauteng, and that we have a marker for that on a normal one of the kits of the qPCR, which allow us to track. At the moment, it suggests a more transmissible variant with some mutation of concern for immune evasion, but that's something that not only us, but tomorrow we are sitting with the World Health Organization, the technical working group, and many scientists of the world is really looking with very strong focus. We are concerned by the jump of evolution, and that's why we decided to highlight that to our government and to the media so early as South Africa. As you know, we're still talking about 1,000 infections a day, where in Europe, for example, certain countries at 50,000 infections a day, which, to the best of our knowledge, this variant is not widespread around the world. Yeah, and what we need is really now is international support, and international support in many ways, and not discrimination, because again, what we have to do is to control this variant, yeah, as we had to control the other ones, so that don't pose a problem to South Africa, Africa, and the world. Thank you, Minister, and back to you.
Thanks very much, Prof. Tulio and other colleagues. I'm now going to hand over to Dr. Nicholas Cripps to make the contributions as far as vaccine is concerned. Over to you, Doc.
Thank you, Foster. Thank you, Minister and colleagues. So the question that was asked for me is about vaccines. We do have 16.5 million doses of vaccine in the country at the moment. Most of that is in a range of central stores, but we are also expecting about 2.5 million doses to be delivered in this week. And so we are getting in vaccine faster than we are using it at the moment. So for some time now, we have been deferring our deliveries, not decreasing our orders, but just deferring our deliveries so that we don't accumulate and stockpile vaccines that, number one, become a risk for us to manage. And number two, there are other clients, other countries, particularly in Africa, who need vaccines as well. And the more that we can make available into the flow of vaccines into those countries, the better it is for us. So we have a very good relationship with our two suppliers, the Pfizer and Johnson & Johnson manufacturers, and we are working closely with them to make sure that we do this in a responsible manner. But if we do have an uptake now, we can assure the public there's plenty of vaccine. We can also assure the public that at the moment we have way more capacity to vaccinate people than we have people coming for vaccination at the moment. Thank you, Foster.
Foster, you are muted.
To Dr. Crisp and members of the panel, as the Minister has already indicated that there's another important activity taking place in Parliament in order to avoid dividing the attention of the public and the media. We'll be closing. I'm going to hand over to the Minister to give us the last parting shot. Over to you, Minister.
Well, thank you very much. An apology to our colleagues in the media. This is not the end of this matter. We just wanted to make sure that you get it as it's said figuratively from the horse's mouth. Not that Prof. Tulio and Dr. Richard are horses, but these are the scientists who give us these scientific reports. We didn't want the second hand to the media and the public. So that's why we had this in a very hurried way because we didn't want speculation to continue. So don't fear that maybe these matters won't be discussed anymore. I think we've tried to respond. I know some of you may feel that maybe questions not 100% answered the way you would have wanted to, but we have tried. I think again, just to say that while this is a major threat, we know the non-pharmaceutical interventions we've been practicing, we need to tighten those. In terms of any restrictions, in terms of the regulations, whether there will be some review of that. That is a matter of time. As we get more information, the necessary structures will meet and decisions will be taken based on available information. But again, we want to say it's never too late. We can protect ourselves against serious illness by taking advantage of the capacity of the country to provide life-saving vaccines, which will be able to help us to avoid serious illness, including hospitalization and ending up in intensive care units. So with that message, thank you very much for my colleagues who joined this as well at a very short notice, the MECs and HODs. We will be working together in order to protect the public. And again, we want to thank our frontline healthcare workers. When news like this break, clearly we know that they are going to be carrying a huge amount of responsibility, and we are very grateful for what they've done over the past 3 waves. And unfortunately, when we thought there will be a lot of lull for a long time, wherein we can focus on other aspects of improving prevention of disease and management of those who are already ill from other ailments. Unfortunately, as this comes, we know it's going to overwhelm other provision of services for other healthcare services. But that's the nature of the time we live in. But thank you very much. Thanks very much, Mr. Mohale, for coordinating this. You are muted.
Oh, thanks, Minister and the members of the panel. The MECs have joined, and other colleagues, the scientists, the members of the media. Thanks for coming on a short notice. I want to assure the members of the media that indeed, as the minister said, this is the beginning. The conversation will continue even beyond this media briefing, and we'll try to avail all our scientists, the minister, the deputy, and other senior government officials to impart this knowledge, to share this knowledge with the media and the public. On that note, I'm going to declare this media briefing adjourned until further notice. Thanks.